Hello, everyone. Thank you for taking the time out of your schedule to join us for another exciting Vaccine Equity Bright Spot briefing brought to you by the Vaccine Equity Cooperative. I'm Jacqueline Dalton, and I have the privilege of serving as your moderator on today. And I'm bringing you greetings from Nashville, Tennessee. I would also love to know where you are joining us from as well, so feel free to let us know in the chat. I'm the Director of Community Engagement within the Department of Health Equity and Stakeholder Engagement at Health Leads. And for the last 9 months, I have also had the pleasure of working alongside our multiple community partners, partner organizations, and individuals to bring the Vaccine Equity Cooperative into fruition. To share a little bit briefly about the Vaccine Equity Cooperative, next slide, please. Since fall of 2020, Health Leads has been a lead partner amongst others whom you see listed here on the slide, National Association of Community Health Workers, Vaccine Confidence Project, Native Ways Federation, Partners in Health, and the Community Health Acceleration Partnership. We work with these partners in carrying a charge for equity in the development and distribution of the COVID-19 vaccine, ensuring that everyone has a fair opportunity to receive it. Starting with our joint statement, which was released back in October and featured many other partner organizations. Since then, the Vaccine Equity Cooperative has aimed to contribute to the rebuilding of community trust to address long-term health inequalities. And especially by doing these things that are listed here on the slide, democratizing information, research, and data, and interacting with a community-based resource hub of care, including caregivers and community health workers, convening and collaborating with philanthropic partners in a network, in the Philanthropic Action Network with the Rockefeller Foundation as a key player around improvement, as well as advocating for and building capacity locally to enable better uptake and building foundation for future crises. And if you joined us last month, we kicked off our briefings by looking at approaches to vaccine distribution and spotlighting local successes. That webinar last month featured the CDC Foundation, Partners in Health, and the Health Network, which is an FQHC in Immokalee, Florida. Today, our monthly briefing is titled Increasing Access and Readiness in Latinx Communities. At the beginning of this month, the CDC had acknowledged that Latinx communities across the US continue to be underrepresented amongst those vaccinated for COVID-19, reporting that only 13% of adults vaccinated reported being Hispanic or Latinx, while nearly 2/3 or 63% of those adults were reported to be Caucasian people. In addition to the systemic barriers that are emerging through the vaccination data, we are also seeing vaccine access and readiness as a challenge in many Latinx communities, even as the vaccine becomes more widely available. Today, you will hear about an ongoing research project, which is collecting public attitudes and experiences with the COVID-19 vaccinations. From information needs to actual vaccination experiences, we'll hear specifically about the implications of this data amongst the Latinx population and communities. We'll also be discussing common and unique COVID-19 concerns and access challenges, as well as what has worked in various Latinx communities across the country and how these efforts are uplifting the presence of local promotoras. Personally, I'm really excited and looking forward to hearing from our two guest speakers that will present during today's briefing. I'm going to introduce both speakers, and these are very high-level bios, so I encourage you to connect with our speakers and their organizations online through their websites and social media pages. Then after our presentations, we'll have some time for questions, comments, and Q&A, but as questions come up throughout the presentations, feel free to drop your questions in the chat. And then behind the scenes, our team will be putting those things in the queue. We might also be dropping resource links in the chat. So the first person I'm introducing today is Liz Hamill, Vice President and Director of Public Opinion and Survey Research at Kaiser Family Foundation. Kaiser Family, of course, is a leader and resource in national health issues and data analysis. And today, Liz will present on the Kaiser Family Foundation's COVID-19 vaccine monitor data, with a focus on vaccination rates and barriers amongst Latinx communities. And our second speaker will be Maria Lemas, Executive Director of Visión y Compromiso, a Latina-led nonprofit organization dedicated to improving the health and well-being of our underserved and underrepresented communities by providing support, training, and leadership development to promotoras and other grassroots community leaders, collectively called promotores, throughout California. Maria will address common concerns, access challenges, and successful approaches amongst Latinx populations, increasing vaccine access and readiness. So now we'll stop sharing our screen, and I'm going to pass it over to you, Liz.
Great, thank you so much, Jacqueline. Let me get my slides loaded up. Thanks, I'm really happy to be here joining you today from San Francisco, California, and I'm here to share what we've learned in our COVID-19 vaccine monitor. This is a nationally representative series of surveys tracking the US public's attitudes and experiences with COVID-19 vaccinations. The surveys are conducted in English and Spanish, and we include extra oversamples of Black and Hispanic adults in each of the surveys to really be able to talk in detail about some of the groups that have been disproportionately impacted by the pandemic. Last week, we released a report that detailed vaccine access, information, and experiences among Latino adults, and that's most of what I'll be presenting to you today. So I will start by setting the stage with what we've learned about people's intentions to take the vaccine nationally over the past 5 months. And starting from the bottom, back in December, before the vaccines were available to the public, we found that about 1/3 of adults overall said they would get a vaccine as soon as it was made available to them. And 39% say they wanted to wait and see how it was working for other people before getting vaccinated themselves. At that time, almost 1 in 10 said they would get the vaccine only if required for work, school, or other activities, and 15% said they would definitely not get vaccinated. So if you follow those bars upwards, what you see over time is that as more and more people saw their friends and family members get vaccinated, those first 2 darker blue bars got larger, from 34% in our December survey to a combined 64% in our latest survey in April that said they had either already gotten at least 1 dose of the vaccine or would get it as soon as possible. At the same time, that share saying they wanted to wait and see shrank over time from 39% to 15%. That's the lighter blue part of the bars. But what you can see really hasn't changed over time is the size of those green bars. Since about January, between 6 and 7% of the public overall have said they would only get the vaccine if they're required to do so for work, school, or other activities. And between 13 and 15% have said they will definitely not get vaccinated. So when we start to dig into how this trend looks by different racial and ethnic groups, you can see that back in December, Black and Hispanic adults were much more likely to say that they would take a wait and see approach than to say they would get the shot as soon as possible, while white adults were more evenly divided between those 2 responses. But over time, enthusiasm for the vaccine across populations has grown, and by our latest survey in April, 64% of Hispanic adults said they had either gotten at least 1 dose of the vaccine or would get it as soon as they could, and that's about the same share as white adults, with Black adults only slightly behind. But still, even though their enthusiasm has caught up over time, we know from administrative data in those states that are collecting and reporting vaccination rates by race and ethnicity that people who are Black and Hispanic continue to lag behind those who are white and Asian in the share of the population that's received at least 1 dose of the vaccine. These numbers are based on total population rather than adults, so the overall shares look different than what we see in our surveys of adults. But as of March 10th, in 42 states where data were available, 29% of Hispanic people had received at least 1 dose compared to 40% of the white population. So there's still a fairly large gap there. So, the title of this webinar was Vaccine Equity Bright Spot, and I actually do think we have a bright spot in our survey data, which is what I'm showing here. So this is another version of the first slide that I showed, but this is just among those who are not yet vaccinated for COVID-19. And what you see here is that among this group, 1/3 of Hispanic adults say they want to get the vaccine as soon as possible. And this is twice the share as we see among unvaccinated white adults. So this means that there's a large group of the Latino population that is already convinced of the value of the vaccine and is ready to get it right away, but they may just be facing barriers in terms of access and information. And that means by understanding and addressing those barriers, there's an opportunity to begin to close that gap in who's getting vaccinated. So what are some of those barriers? Here you see a variety of things that we've asked unvaccinated people about that might be concerns when it comes to getting a COVID-19 vaccine. And I'll walk through some of these in more detail, but I just want to start by acknowledging that across the board, some of the top concerns that we hear from people, regardless of their race or ethnicity, is that they're concerned about potential side effects and safety of the vaccine. You see the top two concerns, including for Hispanic adults, are about potentially experiencing serious side effects or being concerned that the COVID-19 vaccines are not as safe as they're said to be. In terms of specific unknown side effects, 6 in 10 Hispanic adults under age 50 say they're concerned about potential future impacts on their fertility, and this is higher than the 42% among white adults in this age range. So for many of those who have not yet gotten vaccinated, it's important to keep in mind that they're weighing the risk of what they see as potentially unknown long-term effects of a vaccine against the risks of actually getting COVID-19. So besides concerns about side effects and safety, we find that for Hispanic adults in particular, many of the concerns that they express reflect access issues to the vaccine rather than confidence in the vaccines themselves. And here I've pulled out 2 of those concerns related to employment. You can see that almost 2/3 of Hispanic adults say they're concerned that they might need to miss work due to vaccine side effects, and 3 in 10 are concerned about missing work to go and get the shot. And these shares are substantially higher than among white adults who've not been vaccinated. In addition, we find that Hispanic adults who haven't gotten the vaccine are more likely than white adults to express a number of other access-related concerns. So you see here about half are concerned that they won't be able to get the vaccine from a place that they trust. 4 in 10 are worried they might be required to provide a social security number or government-issued ID when they go get the vaccine. And relatedly, 35% are concerned that actually going to get the vaccine might negatively impact their own or a family member's immigration status. And about 1/4 are worried that they might have difficulty traveling to a vaccination site. Now, all of these concerns are more prominent among Hispanic adults than they are among white adults, but note that within the Hispanic population, these fears are further elevated among certain groups, notably those who don't have health insurance and those who are potentially undocumented, which we determined in the survey by asking Latinos born outside the US whether they had been granted permanent resident status. And note for this group, 2/3 are worried about not being able to get the vaccine at a trusted place, and nearly as many are worried about a potential negative impact on their own or a family member's immigration status. In addition to these concerns, our survey identified substantial information needs in the Latino community. So for example, 42% of unvaccinated Hispanic adults said they were not sure whether they're eligible to get a COVID-19 vaccine in their state, even though this survey was mostly fielded after eligibility was opened up to everyone. 29% said they didn't have enough information about where to go to get vaccinated. And 52% said they were concerned that they might have to pay an out-of-pocket cost to get the COVID-19 vaccine, even though it should be available for free to everyone. And each of these information gaps was even larger among Spanish speakers, among those who are potentially undocumented, and those with lower household incomes. So there's a barrier here, but it's also an opportunity to deliver information to people from trusted messengers to help them understand where and how they can get a vaccine and assure them they will not have to pay a cost in order to get it. Our survey also identified a number of strategies that could be particularly successful at increasing vaccine uptake among Hispanic adults. So first, related to those concerns about missing work, over half of unvaccinated Hispanic adults who are employed say that they'd be more likely to get the vaccine if their employer gave them paid time off from work to get vaccinated and recover from side effects. And that's almost 3 times the share of white adults who said the same. One barrier to getting the vaccine can be that it's just not convenient. And we found that 46% of unvaccinated Hispanic adults said they'd be more likely to get it if it was offered to them at a place they normally go for healthcare. And although there have been some concerns raised about the one-dose Johnson & Johnson vaccine following the temporary pause in its use, this one and done option does remain an attractive option for many Hispanic adults, with 39% saying they'd be more likely to get vaccinated if only one dose was required. Another way to make the vaccination more convenient could be for employers to offer it on site to their workers. And we found 38% of employed Hispanic adults say they'd be more likely to get the vaccine if it were offered at their workplace. In addition to removing barriers, certain incentives and requirements might also help increase vaccine uptake among Hispanic adults in particular. So you can see here that at least 4 in 10 unvaccinated Hispanic adults say they'd be more likely to get vaccinated if it was required for airline travel or for international travel. And that shares even higher among those born outside of the United States who may be eager to visit family in other countries. In addition, 38% of employed Hispanic adults who are not eager to get the vaccine say they'd be more likely to get it if their employer paid them an extra $200. And we've been hearing lots from different areas around the country with different types of incentives being tried. So that could be a useful strategy with Hispanic adults as well. Just quickly, because this is an emerging issue, our survey was in the field just before the Pfizer vaccine was authorized for use in children ages 12 to 15. But I do think it's notable that even before this authorization, about 2/3 of Hispanic parents were at least somewhat open to vaccinating their child, saying that once a vaccine was available for their child's age group, they would either get them vaccinated right away or after a waiting period. And notably, a smaller share of Hispanic parents compared to both Black and white parents said that they would definitely not get their child vaccinated. So this is another opportunity. So that's it for my presentation of the data, but I just did want to end with a quick plug for a campaign that my colleagues at KFF are launching later this week in partnership with Unidos US that will feature 75 videos with Latinx healthcare workers, including doctors, nurses, and promotoras, answering questions like those we identified in the survey. If any of you are familiar with the Between Us, About Us campaign featuring Black healthcare workers, this is a similar campaign aimed at a Latino audience, and it will include videos in both English and Spanish. There's a launch event this Thursday that you can sign up for at kff.org. And after that, all of the campaign materials will be available for anyone to use at the URL you see here. So we hope that you'll be able to use these in your efforts to inform your communities as well. And with that, I will turn it back over to Jacqueline.
Thanks so much, Liz. That was definitely an excellent presentation. You presented great data points. I feel like I've just had a crash course in COVID-19 data, but very informative, not only presenting some of the concerns that maybe some of us haven't thought about, making us or requiring us to ask a different question rather than, is it vaccine readiness? It might be vaccine access and some of the logistics around vaccine access that we should be focusing our strategy around. So thanks for bringing up that data. Next, I'm going to pass it over to Maria Lemus, and she's going to talk to us about some more concerns and what she's seeing through her organization, Visión y Compromiso. Maria.
Thank you, Jacqueline. And Liz, thank you very much for that data and that information. I think for us, it really highlights the discrepancy that exists in our communities in getting access to really COVID information, but also to vaccinations. And I'm really pleased to be here and to discuss a little bit about Visión y Compromiso and our integration of the Promotor model in increasing access and readiness during the pandemic. Next slide, please. So I do want to give a little background on, just for a few minutes, on the Promotor model. The Promotor model has been around for centuries in other countries. As you'll see right here on the left, there were Felders in Russia, there are barefoot doctors in China, Latin America. The model is not new to the world. It is new to the United States. It came across in the 60s during the war on poverty, where we started to formalize it. And of course, most popular within the last 20 years. The next slide, please. So who are promotoras? This is a picture of the diversity of who promotores and promotoras are across the United States. We are Afro-Latino, we're men, we're women, we're mothers, we're grandmothers, we're sons, we're children. We are those who we call have the espíritu de servicio, those who really want to serve in our community. We are celebrating our 21st year. When we started 20 years ago, we came together with those wonderful men and women, mostly women. We send in Compromiso, and our network of promotores and community health workers is about 95% women. And we came together when we really wanted to serve our community. We wanted more information. We wanted education. And in those days, 20 years ago, most promotores were volunteers. They were affiliated or associated with organizations, their church, with Girl Scouts, with resource centers. And the promoter model continues to thrive in the community, in those kinds of community-based organizations that provide those important support services. Next slide, please. So we say that we are a catalyst for community social change. We know that through education and information, the promotores are able to make a difference. And this is just an example of some of those things. Next slide, please. We do believe that promotoras reduce disparities and promote health equity. If you look at this chart, promotoras are at the center of much of this work. And the integration of the promotor model, integrating a socio-ecological approach, which is what we do. We support with education and information across anything that affects a family. And that's, and what we find is that the issues vary across counties, across families. In the work that we do through the network, they come together to identify what the priorities are regionally. And through the advocacy component, they're able to see change not only within their families, within the community, but also within their community. Next slide, please. We see that promotoras can affect social determinants of health. We know that one of the big factors in changing the social determinants is employment. And we do have a current workforce initiative where we're supporting the integration of the promoter model across sectors. And we do believe that the promoter model has a space from preconception to death. If you think about the healthcare continuum, there is a space for a promotor to be able to help families in whichever way. And this is across racial and ethnic lines. We really believe that, for instance, Jacqueline, if Jacqueline had a child, had a boy, I don't know if you do, Jacqueline, but if you had a boy, you do, oh, great. Well, I have a young man also. And I would want for Jacqueline's young boy, the same thing I would want from my young man. I would want health, education, to have a job, to be employed, to have a family. Those things run across most racial and ethnic lines. We all want the same thing. And I think that's where the commonality of the promoter model really comes in, is that working together, we can better our community. Next slide, please. This is just a celebration when we bring together promotores every year at our conference, about 1,000. The last 2 years it's been virtual, and virtually we've hosted maybe 3,500 from across the United States, as well as Mexico, Guatemala, and we're now going to be doing some work in Africa also, because of the commonalities. You know, we want the same thing for our children, wherever we're from. Next slide, please. This is kind of the continuation of the transformational model, which is what we call our trainings, and how we move for a promotor, a mom, who is the most important person in the community, how we move them with education and training and leadership. We move them to be these leaders that I'll show you in another slide, how they've been active and really critical in education, outreach, and information in COVID, as well as vaccinations. The next slide, please. As I said, we're very active in workforce, really believing that promotoras are the ones that should be hired as positions open up. We do a lot of work on both sides, both educating and informing the employer, as well as providing support and training for promotoras to be able to move into that sector. Next slide, please. So we consider this challenge an opportunity to engage community experts, an opportunity to increase the bridge between provider and community. We do say that going to scale means partnering with community to be able to engage those leaders in the community to support the priorities. Next slide, please. This is just a slide that talks about our network. And I'm going to let you look at that because I think I'm short on time, but let's go to the next one. So we believe in HACIA una vida digna y sana, which is working towards a dignified and healthy life for all. And this is important because when we started the organization 20 years ago, almost 21 years ago, Promotoras really wanted us to focus on not only the health, but on the well-being of our community and everything that affects it. That's why we really center on the socio-ecological model, that it's not just a physical health, it's emotional wellness, it's our children, it's education, it's jobs, it's everything that affects the family. Next slide, please. So how does that get us to COVID? It's been since March of last year that we started actively engaging in COVID education and information. We have a catalog of over 30 webinars and Facebook Lives that we started talking about what COVID was, what it was as a disease, but also the impact that it has on our community. We started. We have one webinar that talks about the physiology of COVID, for instance. We have a physician on our staff who's a Promotora physician. But we also then started talking about the wellness in our community. We found that like our community in particular, the Spanish-speaking community was experiencing a lot of wellness issues that came from losing jobs, having children at home, not having their partners have jobs, not having food, not having transportation, being isolated. And so we started really being more active in terms of our education and outreach. This is one example where we're at food banks and we're tabling, we're providing information, these are promotoras. Next slide, please. We started doing workshops, both virtually as well as in the community. One of the things that's extraordinary to me is, in particular in the Central Valley with hard to reach farm workers, our staff goes out into the fields. And sometimes they'll even take the place of the worker. So if they had questions and the worker wasn't able to come out for a few hours because they were in the fields, our staff will go out there and they'll work those 30 minutes or an hour in order for them to come out, and then they replace them. That's the kind of commitment the promotoras have. How is it that we could get this information out to our community? They do a lot of door knocking. This is an event that they did in a park. Next slide, please. This is an example of some of the other things. We're very involved in vaccinations and testing. First, educating about COVID. The next was vaccinations. How convincing our community that it is in their best interest to consider a vaccination, getting a vaccination locally. The difficulty was that there were very few that were within their area. So we worked with the governor's office to really bring mobile sites to rural areas, for instance, and to some of the more hard to reach areas in Los Angeles or large urban areas. Next slide, please. This is another example of what they do. Door-to-door knocking, canvassing, phone calls, texting, anything, any way that we can do. We even did caravans, motor caravans, really, COVID information with bullhorns, anything that we could do. We gave away a lot of PPE materials. We were on the radio. I think this one shows one of our staff on the radio using social media. Anything that we could do to catch their attention, to really show the importance of knowing about COVID and getting vaccinated. Next slide, please. This is an example of some more vaccine events and where we were there. The importance of Promotoras is not only in education and outreach and getting them to the vaccination sites, but also the importance of being there when they get there. What we find is that the staff at the vaccination sites may not speak Spanish, may not understand the community, and when they get there, there's a little anxiety. And so we found that it's best for us to stay there, to welcome them, to really help them fill out forms, to kind of lower the anxiety level, especially if there's a long line and they're late. The vaccination process is slow. You have to remember these people are losing hours of pay. It's already low pay and they're already working. And so we found that it's an important place for us to be from beginning to end. And we've been doing that since the beginning. The next slide, please. One economical support is that we've been involved in COVID relief funds, distributing it. We've been distributing probably about $5 million to the community in need. We're able to rally that really quickly, get the funds out quickly, especially in communities where they have little access to food, they've lost their jobs. And what we found especially was that they're not telling anybody, one, that they're sick, and that they can't go out and get food and supplies, that they have no money. They're not telling anybody. They're just kind of hunkering down in their home. And so it's Promotoras who now have developed these systems, these phone trees, and they're looking out for each other. They're also helping with navigation. For instance, if there's a food bank that's available, but they don't know how to get there, they don't have transportation, they don't know where it's at, they don't know how to access it because it's in English. That navigation of resources in the community has been a really important piece. It's the second phase of that the Promotoras are really involved in now. The next slide, please. This is just an example of one of our staff who's been on the radio really talking about where the resources are, where to go for testing, for mental health, for food and financial support. I'm amazed at how much need there is in the community. I've gotten calls personally of, one example is a promotora whose husband passed away a year ago, and she was renting a room and she had no family and she didn't have anybody and she had COVID. And finally she called me and she said, can you just help me with some food? And we immediately sent her food, we gave her money for rent, and the network set up a system that we're on the lookout for those who are in need, who have little resources, little access, or a very little support system. Those are the things that Promotoras can do. Those are the things that Promotoras do informally and formally. Next slide, please. This is just an example of this one I was at. I love this caravan. We were just going through, it was in the Central Valley. It was a wonderful caravan. And what I enjoyed was not just the Promotoras in their cars advocating for, talking about COVID and advocating for vaccinations, but as they drove through the cities, the medical staff were on the side waving to everybody. Nurses were out there waving and thanking them. It was a wonderful thing. I had a great time. And what I appreciated most was that others appreciated the work that Promotoras are doing. Next slide, please. This is just a little bit of information of what Promotoras also did in the census. We were very active and we're very successful in getting information out about the census. As an example of other things that Promotoras have been successful at. Next slide, please. This is more examples of outreach. I think as an example, for me, what's really important is to see that they're very creative. Promotoras will find a way to get into the community. They know how to get there. They know where the important spots are, and they're not shy about entering into communities and into neighborhoods, because that's usually their neighborhood. They're from the community, and besides being what we're called as trusted messengers, and they have the reputation and the confidence of the community, they're really able to see what the needs are and to get some resolve for that. Next slide, please. Some more examples about the outreach that we did. Next slide, please. And this is some more examples. And I'm sure you'll be able to look at it in great detail when you see the whole presentation. Next slide, please. This is where we were, this is an example of where we were actually part of a clinical process. And we have some programs in the community called Me Veo Bien, Me Siento Bien, and Valoterapia, which is wellness and exercise programs. And even during the pandemic, we were able to do these virtually. I think our virtual experience has been very successful. We're still training, reaching communities, we're texting, we're doing all these creative things. And I'm sure the virtual part of our training and education component is going to continue. We're able to reach more people. While there is a deficit in our community about access to the internet, for instance, broadband, many of our communities don't have access. It isn't available in their area, or the cost of broadband. We're able to facilitate that by bringing people together, small groups, or and social distancing, of course, and wearing masks. We're still supporting that. Next slide, please. This is more examples of some of the trainings that we do. This was before COVID, because you see they're close, so that's before COVID, but it's an example of the kind of trainings that we do. Next slide, please. And then we do work with breast cancer. We're part of the clinical studies and investigations, as well as with UCSF. Next slide, please. And for information, I've given you my name and Ugo, who's director of our programs. I'll end up by just saying that I think the promotor model is critical. It's a community-based model. It really relies on those community experts, like my mother, who is a promotora, who brought information to the community. Compromiso and the network of promotoras supports that and provides training, capacity building, and leadership so that they can move forward and provide as much information to the community so they can be employed and so that they can be a constant resource to our communities. And I just want to speak a little bit to what Liz said about some of the hesitancy and some of the access issues. We've been able to diminish some of that because promotoras are able to go out into the community, work with county health systems, work with clinics, and bring our community to the forefront to get vaccinated. Thank you very much. I'm happy to answer any questions.
Thank you so much, Maria. That was an excellent presentation as well. We definitely appreciate you and the ways that you highlighted the unique approaches that promotoras are able to take when working with the community, from the various social media posts to doing door-to-door or phone trees, as you described them, and just being able to navigate, especially in partnering with small businesses and the employer, and just recognizing that importance of the employment aspect and making vaccine distribution more accessible for the Latinx community. And then also speaking to just the different accomplishments that you all have had and how promotores can be used not only in this time or this moment of COVID, but also how you've been supportive in the 2020 census, or also the clinical health behavior work that you talked about as far as advancing well-being and lifestyle for community health. So thank you so much for your presentation. Now we're going to open up the floor for questions. I do see the questions rolling in, and one of the first questions, this is more of, maybe Maria, I'll pass it to you first. Going back to the promotores, you mentioned that this is a model that does not only sit with your organization, it has been around for many years globally and kind of just finding its way into different spaces in the United States. So how is your model funded? And do you sort of know a ballpark number of how many promotoras exist in or are working across the country?
Well, it's hard to find, I think the last number that we saw in California alone was around 10,000. That is across sectors, so that they're working not just in the health field. Promotoras and community health workers, promotoras/community health workers are not just in the health field, they're across all sectors, as I mentioned. In our organization, they're part of diverse groups. Across the United States, we do provide support to other informal networks across the United States. And we know that promotoras exist everywhere. The promotor model has been integrated into the community health worker model. And so I also sit on the National Association of Community Health Workers. And we know that the promotor community health worker model is present in almost any state. And if anyone wants more information, happy to share about the development of the model. I also think that there are local experts that we should look to. There are community-based organizations who've been really integrated in this model longer than we have. We're 21 years old, but they've been around for a long time. And even though the promotor model seems to be a Spanish-speaking model, it's not. It is really across all communities. So in the African-American community, it could be called Sister Friends, or it could be by any other name. And I think those of you who work in institutions really look to those local community experts who've been able to develop this model. We're happy to help to find local experts, and certainly happy to help any agency to find a way to integrate it into their system.
Right. And certainly, as I see one of the questions in the chat being, are promotoras located in Texas? And I would say certainly so. I know one of the organizations that we have an advising partner from is Dia de la Mujer Latina Incorporated, which is located in Texas, and they're a well-known organization in that state. So, and then there's the National Organization of Community Health Workers, right? And so there are definitely is becoming more popular throughout the country. And like you said, just encouraging our attendees to look further into that information online. Go ahead.
I encourage organizations to look to their community experts and not try to develop this on their own. Because I think there's a lot that's lost in that translation.
Yes, and that's an excellent point as well. So working on leveraging those relationships that are already existing, and not redoing the wheel, if you will, that saying. So certainly so. So Liz, going to you, I do have a question, and actually you as well, Maria. I think you mentioned the issue of immigration. So how are you all thinking about, if you're not currently acting around the issue of immigration, around the hesitancy issue, how are you thinking about getting over that barrier, whether working around through other approaches? How are you thinking about that barrier, working towards it, or advocating to maybe erase or get rid of, eradicate that barrier?
Liz, do you want to go first?
I mean, I think what we see in the data really reinforces the need for on-the-ground community-based approaches like what Maria and her groups are doing, because we see, particularly for those who may be concerned about their own immigration status or that of a family member, that they do have a lack of trust or concern about going to official sources for information. They may be less likely to have ties within the healthcare system. And so I think the types of approaches that Maria is taking are exactly the way to reach folks who have those concerns through trusted community members who are much more likely to be able to deliver that information in a credible way, and address those fears and concerns, and let people know that the vaccine is available regardless of your immigration status. You're not going to have to pay a cost to get it. I think that's a really great channel for getting that information out.
I think certainly the immigration status it does cause a fear in our community because of public charge, and so we really have to get that information out. But the usual channels that the state or the counties send that information out, it doesn't get to our community for the most part. And so I think, again, it is relying on promotoras or local leaders to be able to explain that it's okay, especially right now. But there's a lot of fear in our immigrant community, and I think the distrust for for a system that hasn't been friendly to our immigrant community is probably exacerbated right now when we're trying to access. My parents were immigrants. I was born here, but my parents came here with a vision for a new life for their family, and I'm a product of that. But there are still many who who don't see that and who struggle every day with the fear of being deported or being ostracized or not having employment. I just want to give a picture to somebody. There's a woman named Rosa Marta Zarate who's a singer and leads the Bracero program. And Braceros came here as almost indentured servants. And there's a song that she has in her album that's called Me Muero Aquí, which means I'm dying here. And it's a story of a farm worker. He came here and couldn't go back. And he's dying, and it's the story of how he's living here, and he'll never see his family again. Imagine going to another country and never being able to see your parents again because you can't cross the border. And if you cross, you can't come back. And you have family here and you have family there. I can't imagine not ever seeing my son again because of a legal system. And I think we forget that as human beings, that this is really not an issue of a border. It is an issue of just being a family. I think if we think about that and not intellectualize what should be for everybody, not intellectualizing the system, the provision of care, the support that we need, the education for our children, the well-being for our elders. If we stop politicizing and intellectualizing it and think just, what would I want for my mother? How would I want my mother to be taken care of? If we look at the politicians and ask the doctors and politicians to think that way, then I think we would have a different system. That's how we work. We think of promotoras, think about how can I help Maria? What can I do for her? And I would ask everyone to kind of take that perspective also.
Right, and that's wonderful. Going back to sort of that serving spirit that you talked about. So thank you for that. And I do have another question, and I'll start with Liz. Wondering if, well, there's so many questions. So let me go back up. I want to go back to a question about how we see the intersections of disabilities and the social determinants of health intersecting with culture. So we're focused on the Latinx community at this time. So there's a question wondering how you've reached out to marginalized communities within the community that are experiencing not only these racial inequities, but also inequities around disability or homelessness or foster care and technology. What are some approaches that you are taking to get around those barriers?
Is that for Liz or for me?
I guess I'll address that to you, Maria. I apologize.
I think that's a really great question. First of all, we forget about our indigenous communities. Let me just mention that even within the Latino community, we're very diverse. I'm native born, politically affiliated as a Chicana, but I'm different than a Texas Latina, who's different from a Puerto Rican, who's different from a Dominican. This last weekend, I had mofongo and tostones, and then I had enchiladas when I came home. So we're very diverse community, first of all. And then when you get into disabilities, into all these, illnesses, chronic disease, how all those things that affect us, I think that those get lost in who we are as a community. And the way that we approach it is, again, it's a socio-ecological, what affects that community. We're starting a new effort that is going to be focused on Alzheimer's, Parkinson's, and chronic disease, because we're already preparing for the new normal, whatever that's going to be in January 22. Hopefully we're clear by then. What is the new normal going to be when we come back? And we can't ignore all those things that we haven't taken care of. We have a large, Latinos have the largest number of children with, just so blank, children with disabilities. And so how do we support that? We're doing it with training, we're doing it with support groups and advocacy. We have a large advocacy component. We have a legislative day every year where promotoras go to California, to the Capitol, and they walk the halls whether they're resident or citizen. That's a big deal when you see a resident who's from an indigenous person who's walking the halls and they've read the proposal, they've read the bills, this is what they're advocating, and they're presenting it to the legislators. That's a big deal. But we have to do this across all states. We have to really be able to support our communities to speak for themselves and to lift up what's important to them.
Certainly, Maria, I think that's very important, thinking about all communities and also all of the diversity within our communities as well. So now I am going to go over to you, Liz, and ask about the data. Are there any implications in the data? One of the things I heard you talking about was employment, and wondering if there are any implications in the data around employment for public health or other healthcare agencies, and how we might begin to better access Latinx communities?
Yeah, that's a good question. I think we've certainly identified how employers could play a role in making it easier for their employees to get the vaccine and giving them paid time off to get the vaccine and recover from side effects. In terms of how that can integrate with the health system, I think like some of the things that Maria talked about, having people available to relieve workers so that they can go get the vaccine and having it be available on site, coordinating between community health clinics and places where people work would be a great way to address some of those concerns and get more people to be able to get vaccinated.
Jacqueline, I think that the answer to getting more information out is not solely within the clinics and the hospitals and the plans. I think it's really important for us to look at partnering with community-based organizations and all of the resources that we have at hand. Whatever that agency is. I see in the chat they're naming agencies that have been around for a very long time and have developed that relationship with community. So I think the institution, the duty for the institution is to see how to partner and how to develop those systems to support community-based institutions as a tremendous resource. Why have, my dream is that I don't have to go in to get something in my plan, in my hospital, in my clinic, but rather it's out in the community for me so that I can go a block it's a block from me, and I can see a provider, I can have resources, I can support community exercise and nutrition programs, both for all spectrum, for our children all the way to our older adults.
Certainly. And I have another question, talking about local promotoras and thinking just about talking about that trust and the credibility. I want to talk just a little bit about how trust may have been lost around when the J&J vaccine was paused. And now, I think maybe both of you mentioned a little bit about, yes, there was a little bit of hesitancy around the pause, but then we saw the numbers kind of go back up for getting the J&J vaccine and willingness to get that vaccine. So for promotoras who are working in the community and wondering how to get around the elephant in the room or the J&J pause, what are you recommending to those promotoras, and how do they begin to rebuild trust in the community to help regain that momentum of getting vaccinated using that one-shot vaccine?
Well, that's interesting because I'm already vaccinated with Moderna. I had 2 shots. If J&J was around, I would have taken that. But even the promotoras, and we hire a lot of promotoras, we're on a lot of projects, as well as reaching out to the promoter community. And as soon as J&J happened, it really reflected what exists within our community. Some of the promotoras did not want to get vaccinated, and they're going out giving information and education. So and they reflect our community. And the best thing we could do is really talk about the information, the value of it, and dismiss what happened with J&J and said, well, it's now okay to do that. But there are those who question the validity of it, of any vaccine, and that it can affect them or won't affect them, their mistrust. We have one saying, when they start to say they don't know what's in the vaccine and they don't trust that it was developed quickly, I'll say to them, well, do you take an aspirin? And they go, yes. I said, well, do you know what's in an aspirin? And I got that from a comedian. And you have to, at some point, trust the system. And trusting the system when it's not been good to you is a difficult thing to do. And so I think all that hesitancy and comes from a more historical perspective. as it does, I know, from the African-American community back in the Tuskegee days. But promotoras are at the forefront saying, look, I've been vaccinated. It's okay. I survived it. It wasn't so bad. Let's move forward. I will say one thing with the community health workers being placed in 1A, it was a great thing. But they didn't define promotoras as part of community health workers. And so I know in California, we had to fight to get promotoras vaccinated, to be moved up in the vaccination because they weren't identified as community health workers. And so I stress promotoras. That's the community component that is out in the field. And I think it's important to recognize that distinction.
Yeah, so being inclusive in our language as well. And then going back to what you said previously, looking at the story behind the data, and you think you even mentioned it before when you told the story of the individual you mentioned, thinking about the actual individual story beyond the data and making sure we understand that story is really important. And Liz, I wanted to also give you an opportunity to answer that question as well, if you wanted to add anything.
Yeah, I was just going to say, what we found in our surveys in terms of messages that increase people's confidence, it's really emphasizing how effective these vaccines are, especially when it comes to preventing hospitalization and death, that this is really going to protect you and your family from getting sick, and it's going to protect you from getting really sick. That is sort of the #1 message that increases confidence. And then, yes, as Maria pointed out, a big concern that people have is that these vaccines were developed so quickly. But we found that when we tell people that, yes, this vaccine was developed very quickly, but researchers have been working on this technology for 20 years. The technology is not brand new, that this is something that scientists have been working on for a long time, that also is helpful at increasing confidence. But it is about delivering those facts to people, but as Maria said, also telling personal stories. People want to know that somebody that they know and trust had an okay experience with this, and that's what's really important to them.
Thank you. And Liz, we did have a question real quick. I just want to ask you one more question and we'll launch a poll. Where can folks find more data about COVID-19 vaccinations? They're looking at race and ethnicity data. Is that available online on your website?
Yeah, all of our survey data is available on our website. In addition, not my team, but our racial equity and health policy program has been compiling all the different state level data in terms of states that are actually collecting and reporting vaccination rates by race and ethnicity, and that is available on our website as well.
Great. Well, thank you so much. I just want to give a very large thank you and a virtual hand clap as well to our guest presenters, Liz Hamill and Maria Lemus. Thank you for being here and for sharing your information today. And also thank you to our audience. I think we had over 100 individuals joining us from across the country today. You are certainly what helps make these briefings successful. And so we'll ask you to be on the lookout for a copy of the recording and also the slides and email. And stay tuned for more information about our next monthly webinar briefing. Thank you all so much. And we're going to launch a poll here. So if you see it on your screen, please fill out that poll and we'll see you next time. Thank you.